Every day, Yidnekachu Mogesi sees women of different ages to advise them on reproductive health. Since the COVID-19 pandemic began, he says more patients are reporting abuse.
In the staggering statistics, that it has been said that around 300 women, children, it includes boys and girls, have been raped in Ethiopia since the pandemics for the past 80 days. So we should tackle for these problems, not only within that household level, but also within legal framework as well as the health and others. So these are the things that we should emphasize, because it will cause not only sexual and reproductive health challenges, but also mental health problems.
Yidnekachu and his colleagues have now created an online campaign with the hashtag Let's Be Concerned, advocating for more protection of women and children during the pandemic.
Usually, regarding, especially if they are teenagers and if they are this young, as well as young people, they don't usually open up. You should create this circle of trust that you should be transparent, and you should keep this confidentiality with them. So there is this recently figured that only 5% of those cases have been reported. So especially rape cases have been reported. So in order to give these essential services, we have to create awareness that, and also as a health professionals, we cannot be judgmental, and we should be open-minded for those cases.
The same challenge cuts across the continent. In neighboring Kenya, for example, the government is reporting that teen pregnancies are increasing since March, when schools were closed down because of COVID-19. In one region, there are at least 4,000 pregnancies among minors. Officials say some of these come from abuse by relatives. From the onset of the pandemic, the African Union raised concerns that confinement and social distancing might lead to a high risk of human rights violations, especially against women.
As we fight this battle against COVID-19, we should make sure that human rights are at the center of the struggle. And that includes everybody. There is gender violence, the vulnerable community populations, and everyone else. There's a discussion going on within the African Union Commission on respect to gender-based violence, which is recognized and has to be addressed in public and also in private.
Here in Ethiopia, there are at least 3 centers that offer treatment for gender-based violence within the capital, Addis Ababa. But the state of emergency in the country, declared because of the pandemic, hinders movement of people and victims from accessing them. Campaigners can only hope that their plight will attract attention soon. Coletta Wanjohi, SABC News, Addis Ababa, Ethiopia.